Earlier on this show, Congressman Brian Babin had said that that's going to be paid for by taxpayer dollars. Tom Borelli, what do you make of that price tag?
Well, Emma, certainly there's going to be a huge price tag, 19,000 children. Let's put that in perspective. That could fill Madison Square Garden for a hockey or basketball game. That is clearly a huge number. And by the way, this is coming to you in your neighborhood. Vice President Harris just met with Democrat Governor Ned Lamont, my governor, about where to put some of these children in Connecticut. At some point, the local communities are going to be paying for this with respect to housing and, more importantly, schooling. Our schools are probably already overcrowded, and then we're going to have the language barriers. So this is a crisis and a burden that we're all going to pay for locally. And my biggest concern about all of this, and no one's really talking about it from the government, is the emerging public health crisis. We know some of these migrants, 170,000 or so, some of them have COVID. What we have to be concerned about is COVID variants coming through the border, and we have heard zero from Dr. Fauci or the head of CDC, Dr. Walensky. And in fact, Dr. Walensky just issued a report on racism and how that's a public health crisis. This is a grand distraction. It's a public health crisis with COVID. We're on the verge of beating it with the vaccines, and this policy could undermine it all.
Anna Paulina Luna will bring you back.